All right, hello everyone. Welcome to Phoenixville Library, those of you in our community room and those of you in our Zoom room, to our presentation this evening on Pennie, Pennsylvania's health insurance marketplace. To be presented for us by Jeanne O'Brien, who's an outreach representative with Pennie. Glad to have Jeanne here with us, and take it away.
Thanks, Mark. Appreciate it. So just, I guess we were talking in the room a little bit about if you have any knowledge of the state-based exchange, if you don't have knowledge of the state-based marketplace, this is the time to learn about it. The American Care Act, I followed it from the very beginning, and that's how I ended up in this role this late in my career, starting a new job, but was so happy to be able to come and serve with Pennie. So for a little while, people were calling me Pennie when I first started working here, but my name is Jeanne, and I'm fine with Pennie. It doesn't matter. It's just fine. If you have any questions please just shout them out, because I'm not going to be able to see the Zoom screen to see if you have your hand up or not. Please, you can unmute yourself and ask your question.
Or type in the chat.
Yeah, or just in the chat. Sometimes the American Care Act is a confusing bucket of worms, and right now it is even more so. At the end of our presentation, we'll go over a little bit of some of the federal changes that are happening at this time, and if they're going to happen and when they're going to happen. So it's a different story. So Pennie is a place where people are looking at low-cost, quality coverage, so they don't have to worry about being uninsured. We have local support. Pennie is a, it's stuck there.
Hit down, hit down arrow.
There we go. So what Pennie is it was launched in 2020, so we started up a new business when the pandemic hit. We opened our doors for all of a week, and the week later we closed our doors. Not meaning that we stopped offering services, but what we did do is we went remote. So all across Pennsylvania, there's about 50 people who run the Pennie platform here in Pennsylvania. We considered ourselves a startup in the beginning, but now we are a legitimate business that is doing very well and very, very profitable. So when people ask questions a little bit about how Pennie came to be or how you fund yourself, so we replaced the federal healthcare.gov here in Pennsylvania. So if someone goes to healthcare.gov, what will happen is they're going to be directed to Pennie. And it's not a scam, it's just where you need to go if you live in Pennsylvania. So like every good state agency, Pennie is an acronym. So PENN stands for Pennsylvania, I stands for insurance, and E stands for exchange. So it is an acronym, but it does cost, we like to say it does cost you pennies to be able to do it. We have run through, this will be our 5th open enrollment that starts on November 1st. So we really are trying to make this business be profitable in many ways, and we hand all of that profit back to our consumers so that help them with some type of credit so they can be a little bit more affordable. So you can see these are some on the screen now. You can see all of the different people who can use Pennie. So if you're of Medicare age, you're not eligible to come onto the platform because you have a Medicare product. If you are low income and are able to access Medicaid, you go that route. So for everybody else who doesn't have health care insurance from their employer, they are able to come onto the Pennie platform and purchase insurance on that platform. There's a number of insurers that participate with us here on this platform. And you can see, I went in to meet with a small business group in Philadelphia yesterday. They took me out to dinner. It was very, very nice. But it's the whole hospitality industry. None of them have benefits. None of them have any kind of health care insurance, and they're working nonstop in that hospitality industry, late hours, very physical job without health care insurance. So we were able to introduce to them a little bit about that. I think my greatest find recently was I discovered that the Philadelphia Orchestra, even though the orchestra may have some type of health care insurance through their union, those workers who build the sets, the people who usher you in, all of those people, even the people who work for the Philadelphia Ballet doing their marketing, none of them are insured. So we have a monthly session that we meet with workers who are newly hired into the Philadelphia Ballet and help them enroll onto the platform. So we're doing a great service across the Commonwealth. You can see that Philadelphia is probably one of the highest uninsured areas. Lancaster County is next. That's where I'm going tomorrow. So I'll be spending some time in Lancaster County tomorrow, helping some people learn a little bit more about Pennie. But you can see the percentage across Pennsylvania, how uninsured. Some of the gray areas, there's just not enough people to live there for us to get a percentage. But you can see Philadelphia County is very, very dense and pretty uninsured. I spend the majority of my time, I live here in Montgomery County, but I spend most of my time in southeast Pennsylvania with Philadelphia as my #1 concern, to make sure that we are making sure that those people have the information they need to enroll. So the idea of Pennie is that you're going to get high quality health care coverage at a very affordable price. So we like to help people understand what it means to be uninsured. To be uninsured, I know for myself, I had a period of time where I had lost my role, and I thought, you know what, I'm just not going to have insurance until I get another job, I'll be okay. So I decided to go to my mom's house and help her trim her trees, and I fractured my wrist. No health care insurance, I just put a brace on it. And to this day, it still gives me great pain because it never healed right. Had I gone in and gotten some health care insurance, I would have been a little better off. I would have been able to get it x-rayed, it would have been treated, and I wouldn't have that long-term piece. Good.
I just have a quick question. Is this only for people who are not insured? Is it for somebody that already has Medicare?
Medicare, no, people who have Medicare have a quality product. People who have Medicaid have a quality product also.
Okay, so this is for people that at present have no coverage.
Correct. Anybody who's between the ages of 65 or just before 65 and birth are eligible to come onto the platform if they do not have health care insurance through their employer, through Medicare or Medicaid. Does that make sense? There's a lot of them. Yeah.
So if somebody is a certain age and already has Medicare, this is not for them?
It is not for them. But you certainly, to have this knowledge in hand when you're sitting and talking to a friend who maybe wants to retire a little bit early, like Mark and I were talking, I'm only 62, I'd like to retire before I turn 65, so I'm gonna have to find a way to get health care insurance for that year in between when I retire and when I'm of a Medicare age. I just went through this with my sister. She worked in the education system her entire career and she just wanted to be done. She was done. So she had 1 year to retirement. She could have jumped onto the Pennie platform. She chose to take her COBRA from work just because it was easier. And then what we did is a month later into her COBRA, we realized how much money she could have saved had she gotten that same plan on the Pennie platform. So she discontinued her COBRA, which she could. In most cases you can't. It's usually a contract. So I spend most of my time going out and talking to companies that are laying off their workers and talking to their workers about jumping onto the Pennie platform until they find a new job. So they're not uninsured because they've lost their employer insurance. So they have a qualifying life event. And we'll talk a little bit about those qualifying life events also. But we really think the value of coverage, just having that peace of mind to have some kind of insurance and know that you're going to be covered is the way to go. You can see the peace of mind that you receive, that through Pennie you also get a little bit of savings. Some of these things will be changing. So we had really talked about a young man that you had in your life that needs to navigate this. Right. Some of the things that he'll be able to take advantage of it is an advanced premium tax credit, and that tax credit is something that is based on your income. So a lower income person is going to get more of a tax credit, and a higher income person will get less of a tax credit. And that tax credit comes right from the IRS directly to you so that you can pay your health care insurance premium. The second piece is the cost sharing reduction. So people who might have a little bit of a lower income, we're gonna make sure that they have a plan that does not have a really high out-of-pocket expenses, like a $45 copay. That copay might be $5 instead of $45. Or to visit a specialist, $10 instead of $75. So we really help people be able to save something. Right now, 90% of our customers are receiving this financial assistance. Now, the federal government has also offered more, that enhanced premium tax credit. You've probably heard about it in the news. That legislation comes to the end at the end of December, and it does need to be renewed, and as of now, it has not been renewed. So that's where people might have to pay a little bit more, and we'll talk a little bit more about those federal changes and when they're gonna take place. So these are each plan that's on the Pennie platform has each of these 10 essential health benefits. So you think about when you were working and you had your health care, you could go to get prescriptions, you could go get an x-ray, you had maternity care, well baby care, all of those things are covered in each of the plans. There are catastrophic plans that are on the Pennie platform, but we don't encourage those plans. People who are under the age of 30 are welcome to purchase those. And that's another change that might be coming along with these new federal guidelines. But we can't be denied if you have a pre-existing condition. That's a beautiful thing, and you cannot limit your spending on any of your care. For me, that's a bonus. I had double knee replacement done last year, and it didn't cost me a cent. I knew how to work my insurance. I made sure that I scheduled the surgery after I had met my deductible, and I was able to walk away with only having to pay my copay to go to physical therapy. So knowing how your insurance works is of great value also. And that's something else that Mark and I will talk about to offer maybe a healthcare insurance literacy workshop here at the library that teaches you how to walk through it. And even people who are Medicare age, I've spoken to people at those workshops who come in with their plan and they don't know how to work it. They don't know what it is. They don't know what a co-insurance is. They don't know what their co-pays are. So we can go through and we review those on an individual basis and be able to help people out. And that's a very popular thing at Pennsylvania Career Links and different libraries when I come in and talk about that. So across Pennsylvania, there are only certain insurers who are on the platform. In our region, you can see we have all the big ones, Highmark and IBX, those big Blue Cross Blue Shield are part of the platform. Jefferson, Oscar, and the PAHW for our region. But across Pennsylvania, you can see they're a little bit different because it depends on the region that you live in. Your healthcare insurance costs are based on where you live, how old you are, and how much money you make. That's just how the industry works. That has nothing to do with Pennie itself. So let's talk a little bit about how you enroll and when you can enroll. So when you come in, you come onto Pennie.com, you can call our contact center, you can have a local enrollment assister help you, or you can just go online and do it yourself. You can compare plans through our plan comparison tool, you can gather all your household information so that you're ready to do it. And I can share this deck, Mark, with you if anybody would like it. You can send it out to the participants, most definitely. You go through, filter your plans through, and then once you pay your premium, your healthcare insurance starts the first of the month. Following that, you're covered, you can enjoy the peace of mind that you've always had. Sounds simple. It's not as easy as that, though, as we all know. So let's talk about when you can enroll. This is our open enrollment period. It begins on November 1st, and it runs through January 15th. And that's when anybody who doesn't have health care insurance through Medicare, Medicaid, or their employer can jump on board. You don't have to have a qualifying life event. You can just come. The door is open. So at the end of that open time, at January 15th, when that ends, we open the door again for people who haven't enrolled yet. So we call it the path to Pennie, and I'll talk a little bit about that later. Our first deadline, though, is December 15th for this open enrollment period. We want to make sure that if people enroll by December 15th, their plan will begin on January 1. so they don't have any lapse in their health care insurance, hopefully. You don't need to have a special enrollment period for this time. You don't need a qualifying life event, and we'll talk a little bit about those. These are some examples of what a qualifying life event is. So if at another time during the year, say in August, I get laid off from my job, and that is a qualifying life event because I lost my employer-sponsored insurance. So I lost my health care insurance, so I can jump on board. If I have a change in my household, if I have a baby, hope that's not happening to me at this point. If you have a change in residence, if someone moves from Delaware to Pennsylvania, they're a new resident. If you move into a different rating area, remember that map that we showed all the different insurers on? If you move into a different area in Pennsylvania where your insurer's not there, that's another qualifying life event. One of my favorite right now is when we have a citizen that is returning through incarceration, that we have a 60-day open enrollment period for that individual from when they're released to make sure that they can get health care insurance. So we try to keep the door open to as many people throughout the year as possible. We can't always leave the door open, but those things do help. This is a little example of about how the Pennie works. So when you start doing your taxes, then at the end of tax season, this ends, when you go to, I know H&R Block, they have a checkoff point. Do you want to learn more about how the state-based exchange? And you can check it off. And because we have an open door policy with the department, with the IRS, we are able to send you a quote because we know how much money you make, we know your household makeup, and we know where you live. So we can give you a general quote. And then you have 60 days to respond to us from that quote to be able to enroll on the platform. So this is the path to Pennie during tax season. And it's not as complicated as it seems. And it's just a simple form, and that form is Rev 1882. It's available on our website. You can get it from your tax preparer. I believe a lot of the tax forms are right here at the library. I don't know if that one's here, but I'll make sure you have some. I'll make sure I print some out so you have them here at the library. So it's just another way for us to leave the door open just a little bit longer so that people can jump on board with Pennie. So our no wrong door policy. So people who come to us who may be eligible for Medicaid, instead of just telling them, nope, you can't come on the Pennie platform, we make sure that we send their information to Medicaid to start their application with the Department of Human Services. So they already have a head start on their Compass application, and they're able to make sure that they can be insured. If for some reason they no longer are eligible for Medicaid, they're able to come, they get a notification, and they can just contact our contact center and we'll make sure that they're insured. These people who are kind of on the edge of income, but they make just a little bit too much money for Medicaid, they're the individuals who are going to get the most financial assistance. They're going to make sure some of those people are only paying $1 a month for their health care insurance. So they get tons of assistance as they walk through. And know that we have that no wrong door policy with CHIP and with Medicaid. So somebody who has children, we make sure that their children are covered because they are our most vulnerable citizens. So there's some changes this open enrollment period. There potentially may be some changes when it comes to the timing of our open enrollment period. These are some of the federal changes that have come through with the big beautiful bill. The enhanced premium tax credit, that extra money that we are getting from the federal government, those individuals who are receiving those, as of December 31st, that is scheduled to end. But we are still waiting to hear. So there is a potential piece that up until December 31st, if they decide that they're going to renew it, we'll make sure we'll have to change when our open enrollment period is. I believe the decision will come down prior to, we're hoping before November 1st. And if it is extended, we have to then make sure that all the plans and all of those pieces are in the operating system, so when someone enrolls, that's all in there. But with the expiration of these starting in January 2026, costs are definitely gonna go up. There's no question in my mind it will be premium-based, where that financial piece will not be enough. There might be some people who are paying $30 right now a month for healthcare insurance that may end up spending $300 a month for healthcare insurance. That's the difference that it is. I think that's what you're seeing on the news and.
And more, yeah. I'm praying for your son.
Yeah.
Looking for the medical.
You got it.
If you only knew.
Yeah.
I'm being quiet.
I try to. So.
You're better than me.
I know. So you can see that some of the changes that are gonna take place are really gonna impact people's pocketbooks. So we have really worked diligently with our local government. Lisa Borowski has been amazing, Madeline Dean has been great, Art Haywood has been great, really making sure that they're voting in the direction to continue these pieces. So we have a lot of legislators who are really fighting against some of the changes that are coming from the big beautiful bill. And we have an entire legislative division that just dedicates itself to that. So we are working really hard, and we're actually working with the other 17 state-based exchanges, and we've joined forces. Pennsylvania has chosen not to be part of the lawsuit. I know, that's above my pay grade, so, but it is something, some of the other state-based exchanges have come together and done a group lawsuit when it comes to those pieces. So know that the fight is still on. We're not settling down for it. We are still working to see if we can get some of these changes rectified so that people can afford to have health care insurance. Yep, that's right. So really what we're encouraging people who already have Pennie, we're encouraging them to go back in and shop. Make sure that you read all of the communications that you receive from us, from anything that's Pennie, either on your dashboard or an email that you receive. Like and share us on social media. Prices and plans change every year, and that's a given. Every single year you have to reshop, but especially this year. This year is going to be extreme. We have, and Pennie enrollees are given updated information as often as we can. As of now, our open enrollment period will begin on November 1st. We haven't changed that. If it changes in any way, it might change till November 10th. If those enhanced premium tax credits are extended, our open enrollment won't begin till November 10th. But right now, we're still saying it's November 1 through January 15th. And there may be a piece that we might be able to extend it to the end of January. Now next year, that open enrollment will change a little bit more too, because part of the big beautiful bill was some of the restrictions on how long an open enrollment period can be. So that will affect Medicare and it will affect Pennie, more so than anything else. Not necessarily Medicaid, but Medicare. So keep an eye out for when reshopping, checking your plan out, things like that as you're walking through. Some of the things that will change too is if your income information isn't updated, you no longer will be eligible for any tax credits. So if every year that information is not updated, you're done. You can't receive the tax credit that year. So that's probably the most important things. This is on the must-to-do list if you are a current Pennie customer or considering purchasing a plan on the Pennie platform. So Pennie's here to help. I happen to be local to this region, but we also have people all across the Commonwealth that can assist. We just adopted a new regional organization approach. So we have a lead contractor. It's Health Market Connect that has worked on the federal level, but never on the state-based exchange, which is very different than the federal level, but at least they're familiar with it. They are coordinating all of our regional organization partners, and those regional organizations are in very specific areas, and they are across Pennsylvania. They are contracted, paid contractors with Pennie, so that we can be in more places than we ever were before. There's only 2 Pennie outreach coordinators. One lives in Mechanicsburg, and there's me that lives here in Montgomery County. So it's there's not a lot of us. We spend a lot of time running. I'll be going to Lancaster tomorrow. Later in the week I'll be in Bloomsburg, and I'll be out to Pittsburgh on Thursday. So I drive a lot. I was so thankful just to drive here tonight. It's only 20 minutes from my house, so I was very thankful to come here. But those regional organizations really do help us oversee all of the counties. If there's something specific, like if we wanted to run an enrollment event here at the library, they would come and do that. I would just set it up for them and they would come and enroll people. That's what their primary place is enrollment. When it comes to education, the Pennie staff does that. But they help us out with everything else. But our real goal was to increase awareness as much as we could across the Commonwealth. So you can see the different people, the different groups that are helping us out in the different counties. Mendoza Group is our local group right here. You may have heard of them before. They are a large organization that manages many contracts here in southeast Pennsylvania. And you can see some of the other ones in the Harrisburg area. We have YMCA. That Pittsburgh one, I thought that our sister out there was going to take it for me, but that's okay. I don't mind driving out there. I've been to Pittsburgh for a little while. It'll be a fun drive. So you can see how they're going to help us out also. But know that there's help everywhere you go. Pennie.com, you can go there to learn everything. We have a savings calculator right online there. You can enroll, you can get all your questions answered, search our frequently answered questions. You can find anything you'd like. You can call our customer service center, 844-844-8404, and they're there from 8 to 6. During open enrollment, they're there from Monday to Saturday, I believe, and they have limited hours on Sunday.
844-844-8040. Okay,
Sorry,
thank you.
Mark.
Okay.
Thank you. And then we have trained enrollment assisters and brokers across the Commonwealth. And they don't just have to be here in Pennsylvania. There are brokers in California that are Pennie certified brokers that you can access. You don't have to worry about making sure that you're having somebody in your neighborhood. But we want to make sure that if you want somebody in your neighborhood, there is somebody in your neighborhood that can help you. I get my hair cut at Tornami's right around the corner from here, right in Audubon, and everybody in my barbershop is on the Pennie platform because they don't have health care insurance. So they all have purchased it on the Pennie platform. When they have a question and they need some help, there just happens to be a Pennie certified broker right across the street that can help them out. So know that it can be local help, but it can just be a phone call. If you feel like you need to meet face to face with someone, that's fine. But you have all these other choices that you can take advantage of. So there's no excuse about not finding help. There's plenty of help there. And then our younger people who don't want to talk to anybody, they can just chat. They don't have to talk to anybody. They can just chat and get the information that they need. It all works out just wonderfully. So we let everybody know that if you're part of a community-based organization, help us. Tell all your friends so I don't have to. Like our social media, share it on your platform. Talk to your local constituents. Talk to your local elected officials. Make sure that they know that you care about the American Care Act and what it can do for people. If you're part of an organization that I can come out and talk to, I'm more than happy to come out and educate staff or the community at large. Invite us to your community events, like spooky nights here at the library. I might have to go upstairs and check that out. We're even more than happy to come to things like that where we bring swag with us so that people can ask us questions. Any kind of networking event, I'm more than happy to go to. So if you know of anything, let me know. Mark has my contact information. I'm more than happy to travel anywhere to talk about what Pennie can do for people. So know that we're here to help, and we're here, even though we're in Harrisburg, we're everywhere across the Commonwealth. And we were more than happy to help with any concerns that you have. So I wanted to make sure that I left enough time to answer any questions that anybody might have, or are you confused about something, or if there's something specific that you know you want some help with, I'm more than happy to give you some direction there. Because your question, I guarantee you someone else also has that same question. I run into this again and again and again. I think the big question right now that comes from a lot of Lisa Borowski has sent me this question from constituents many, many times is there a mental health rider that I can purchase? Medicaid evidently doesn't have very good mental health services. So these individuals are out shopping maybe for a rider on a mental health plan. That's not what Pennie is. Pennie is to get you covered all the way around. So those individuals, because they have access to Medicaid, do not have access to the Pennie platform. They already have a good comprehensive health care insurance and do not need it. Also know that we have a toolkit online, so if you work for an agency or volunteer at an agency that would like some print materials and information, don't print it out yourselves. We'll send you things beautifully printed on beautiful paper at no cost whatsoever. So you saw we have about 500,000 people on our platform right now. 90% of those people are receiving financial assistance. But all of those peoples, all of those 500,000 policies, so Pennie receives a user fee from the insurers. So your taxpayers don't pay for any of this. Your tax dollar doesn't pay for anything that we do. We are self-funded. So know that if we hand you a beautiful pen to use or whatever, we are self-funded because of the hard work we do to keep our enrollment up. Of course, we are a little concerned about this next year, but we are also have enough funding to last us for a period of time. So let me know if you have any questions. More than happy to answer them.
I had a question.
Sure.
Hi, this is Anne-Marie. When you're updating your income, can you define, is it strictly earned or earned and unearned?
That's a good question.
I always get confused with that.
Yeah, that is a good question. It's anything you have to pay taxes on. So if you have, if you're receiving child support, I don't believe that that's taxable for you. That's not something that you would include. So anything that you would include on your tax return as income would be what you would report with Pennie. And you can update that at any time during the year. It doesn't just have to be that one time when you enroll. It's year long. You can go in whenever. People who are entrepreneurs, very often their income changes and it's hard to predict. As much as they'd like to have this great income, sometimes it's not so great. So as month to month, as they're going through, realtors are number one. They are always having to update their income. But you can update your income at any time. You can either just call the contact center or you can go online and do it. I always tell people just call the contact center. It's the easiest way to go. It's totally the easiest way. That's a good question though, Anne-Marie.
Well, a follow-up though, if I'm updating during the open enrollment and I'm updating my income, is it my income for this year to date? Or, there's a lot of dividends and capital gains that happen at the end of the year. Mm-hmm. Like I don't know that information yet. What do we include in November, at the open enrollment, at the start of the open enrollment?
You may have to guesstimate those things. But look at your previous years. If you had a little bit more of an income from a capital gain, you definitely would want to put that in there, because if you underestimate your income, you're going to have to pay it back. And it comes out of your taxes. So when you go to prepare your taxes that next year, so the income that you're looking for is what you're predicting you will make next year.
Oh, for next year, okay.
Yep. So you have an idea of what you've made this year. It's prediction of what you would make next year. I always recommend to people that they over-predict so they don't have to pay any money back.
Okay, so if I over-predict, I should see a change in what I owe in taxes then.
Correct, yeah, so what'll happen is if you over predict, at the end of the year, you may get additional money to pay your premium. As you're going throughout the year, if you see that there's a change and you make a change that maybe you had over predicted it at the end of the year, you'll either get money back, but if you under predict, you're gonna owe money, and that's kinda hard at tax time, when you're not prepared for that.
Right.
Most definitely.
Thank you.
Mhm.
Thank you.
Do you address the process of annuitization when somebody has had annuities and then they are annuitizing? Do you address that as part of income?
Yep, as long as, if you're paying taxes on it, yes, because once you've taken that, you're gonna have to pay tax on it.
Amen, yeah. And sometimes that's not the best thing to do, but yeah.
Yeah, and I think sometimes financially, we can't guide someone to how to schedule their income from a pension or from a retirement account. We can't guide anyone along, but a broker can help you with that. A broker is licensed to do that. So we usually will recommend to someone, if they need a little bit of help, go on to Pennie.com, click under help, and under help it'll say, would you like to see a broker or an assister? If you've already completed that application, go for the broker. The broker is the only individual that is licensed to help you choose your healthcare products. And sometimes if you could choose a broker that is also a financial advisor, that's a bonus. That's the way to go, is you get that broker who can help you out there, you're good. You really have got it made. Brokers are probably our most valuable asset as we walk through this. They're the ones who really, they know their business, and they truly are. An enrollment assister can help you fill out that application, but if you need help selecting a healthcare product, you need to get a broker. We talked a little bit about that enrollment process and how it looked so easy there. It really isn't as simple as that. The enrollment process is easy. If you know your income, or you can predict your income, and you know where you live, you know all of those, you know your household makeup, those pieces are easy. But when it comes to selecting a healthcare plan, that's where it's hard. What do I need? So you need to know about, what medications do I take? I probably would not choose a healthcare plan that my orthopede was not on. I totally trust that orthopede. I ran the gamut of a million orthopeds and found one that I was comfortable with. So if my orthopede's not on that plan, that's not what I'm planning. So when you're going through the Pennie, on the Pennie.com site, and you're going into selecting a plan, you can choose the hospital that you prefer. I only want, show me plans that only go to the hospital I prefer, that only have this orthopede on them, that maybe there's a specific medication I take. I'm gonna make sure that I choose a plan that has my medication on there. So it's of great value to know how you would use your healthcare insurance before you go to purchase it. Because sometimes when you're working, and I think even with Medicare, there's a lot of choices out there. There is a lot of choices. And that PA Medi, those people are a great help to us to be able to help make those choices here in Pennsylvania. They're a valuable resource, and I think that's probably the only place that you'll get an unbiased opinion, is from a PA Medi rep for people who are of Medicare age. But they're the individuals who can help you choose a plan, are the brokers. They're licensed for that.
Have you worked with the senior center here in Phoenixville yet?
Mm-hmm. Yep.
Do you know Carrie?
Yep, I do. Yeah.
So-
I sent an update I just sent my update to Carrie today, what's going on with that, what's going on with everything. Because there's many people who participated in a senior center who aren't 65.
Amen.
Yeah, there's people who are, maybe 55 and up that are, they have that 10-year period where they're not of Medicare age, so we always make sure that we're directing them in the right location. A lot of people who were, during the pandemic, that's how we grew. We were a startup business, and because of the pandemic, so many people retired. We were a booming business because of that. So many people retired. Yeah, so they're all good questions. I think, Emery, that question about income is probably the most common question that we get from individuals. It's for people who don't have a regular income, maybe not a salary and they're hourly, or maybe they are an entrepreneur, or maybe they're, whatever it is that is causing that fluctuation in their income. That is probably the hardest thing to deal with, but the greatest thing I can tell you is go in every quarter and update your income. If you see something's changing, you can do it. You can do it every month if you want to. It doesn't matter. You just want to make sure that you're not underestimating your income.
Okay, what about, this is another question, I guess. If a lot of our, my husband, I've been enrolled with Pennie the past 2 years, but the income, some of the income is joint with my husband, but he's not enrolled in Pennie. He's a Medicare age, I am not yet. So do I take half of that income and consider it mine, or do I report it all?
It's your household income.
It's the household income,
Yeah.
even though he's not applying for it.
Yeah,
Okay.
it is your household income. And any time that you run into any little question, do not hesitate to call our contact center. It is not like you're calling, IBX, because when you call them, you're on the phone with them all day. We answer the phone within 2 minutes. If we don't answer the phone within 2 minutes and you're not talking to someone with getting through the queue, as long as it takes you to get through the queue, somebody answers the phone right away. And we actually do not run our own call center. We pay healthcare.gov to have a division to just answer our phones, but we just have a bank account big enough that we're going to be starting our own call center. So it will be staffed by individuals like myself who are knowledgeable and are able to answer your questions here right in Pennsylvania. And the requirement will be that everyone who mans that call center is a Pennsylvania resident. So taxpayer dollars going right back into our state. So now don't hesitate to call the contact center though, and if you don't get the answer that you like, ask to speak to a supervisor, and they escalate it up, and usually by the time it gets to there, it's coming to me and I'm calling you. So know that anything that is escalated, it's given directly to individuals of knowledge, who have a large knowledge base that can solve your problem for you. But know that don't hesitate to call if you have any questions. When you first enrolled, Emery, did you do it on your own, or did you?
I did. I think I did, call a couple times with similar questions. I was just shocked at how much I have to pay. Which, granted, it was the best thing. I needed it this year with a fall, but that I had, and surgery and things like that. I was glad I had it, but it's, I knew someone who did the same thing, and her premium was so much less, and I couldn't figure out. We were both the same age. We were both retired prior to being, Medicare eligible.
Uh-huh.
And I couldn't figure out what the difference was, why I was paying almost twice as much as her. And then I figured, well, it has to be the, maybe dividends or, whatever, savings.
Do you guys live in the same rating area? Oops.
Yeah, we do.
Okay, because that's what I was gonna say, is this screen shows you the different rating areas. So each of those rating areas, so when the federal changes come into place, when that really does occur, and if it does occur as it's currently scheduled to be, those rating areas here in the Philadelphia region, I think that we will probably be experienced. Maybe somebody might be paying like a couple $100 a month for healthcare insurance. But as you move further out, and in particular like Jeanne and Fulton in that rating area C and 9 and 6, sometimes those people, they're going to be paying close to $400 more than what they were paying before. And that's what this new federal change is going to happen. So people who live like in Fulton County or Jeanne County, in that blue area, purplish area, I don't think they're gonna be able to afford healthcare insurance. I don't know why it's so expensive there. The rating area 6 is, they're not gonna be able to afford healthcare insurance. And it depends on where you live, your household makeup, and how much money you make. So it's, for you guys, it's definitely a financial piece. But if I were you, I would definitely get in touch with a broker. Go onto pennie.com, click on get local help, look for a broker. You just put your zip code in, and I guarantee you, you'll have 10 pages of brokers that you can choose from. And if you call a broker and you say, don't go online, don't go any place but Pennie to look for this, because if you go online and search for a broker, you're gonna be getting phone calls for the next.
Right, they all wanna call you,
Yeah.
I've done that.
The next 3 months, every 10 minutes. Don't do it. Don't do it. Yeah, so that is of great value. So you can see the different rating areas. Sometimes that's the thing that makes the difference. But for you, it's probably an income piece that is going on. So know that we're here to answer any of those kind of questions. But don't be afraid to call our contact center though. They're good at what they do. They're trained thoroughly. If there's something that is new that's going on, we have Pennie staff that's training those individuals. Any of the federal changes, I'm so impressed with the team that we have at Pennie. I never thought that I'd be so deep in federal decisions as I am right now. Never ever did I believe that I would be this deep into what's going on in the government, because it matters to people. This is going to make a big difference for a lot of people when it comes to what's coming out of their pocket. And my greatest fear is that people are going to go uninsured. There'll be a large number of people, I believe, out in that Jeanne, Fulton County that aren't just going to be able to afford healthcare insurance. They're going to have the biggest jump in what this coming year's rates are and how much they're going to have to pay for their healthcare insurance. It's going to be unbelievable. So what if you're in your region though? You can check for a broker, talk to a broker, and see what they can help you. They might be able to help you choose a different plan. They might be able to help you rearrange. Pick somebody who does financial planning too, or if you have a financial planner, they might be able to help you with that. I guarantee you they can limit your income and find a way around some of those pieces so that maybe you can get a little bit more financial assistance. But good luck with that.
Thank you.
And what is your name?
My name's Jeanne O'Brien. You can call me Pennie though if you want to.
So what okay.
Jeanne O'Brien.
Jean?
Yep.
Okay. Awesome.
Questions from anyone else on Zoom? Or in the room?
Go ahead, go for it.
I'm speaking for my son,
Okay.
who quit his job because he's such a damn perfectionist. Anyway, I'm assuming he has filed a state tax return because he has some interest income, but not a federal tax return for the last 2 years because he's below the threshold where he has to do that.
Okay.
So, is that still okay to, to fill out the form for the state tax return?
Absolutely.
Okay.
Yep.
Because he wouldn't care about the federal tax credit because he hasn't.
He would still receive it.
Yeah. Oh, I see what you're saying.
Yeah.
Yeah.
So some people who are very low incomes don't have to file federal taxes because they're so low income. And those
Well, I
people
mean,
they are the people who get the greatest financial assistance.
He's low income because of his own stubbornness in a way. So,
So his big point though is because he left a job on his own.
right.
It's not that he lost a job at no fault of his own.
No.
So he didn't lose his employer-sponsored insurance. He walked away from it.
Yes.
He would have to wait until November 1.
Okay. All right.
People who were laid off, they have a 60-day window from when they lose their health care
Yeah,
insurance
no,
coverage.
he was not laid off. He,
That's okay. They all do it.
yeah. No, I mean, he's an aircraft mechanic and he demands perfection.
He needs to move to South Carolina.
And so, you know,
Mhm.
times change and standards haven't been as high, and so he just said, that's it, I'm done.
I was just down in South Carolina and saw how Boeing was growing beyond belief there, and they've laid everybody off. I go to rapid responses
Wow.
every month with the Department of Labor. They're laying everybody off here in Philadelphia. South Carolina is the place to be for those tool and die and all those people who are building those
Right.
big airplanes. Yeah, so he will get financial assistance.
Yeah, I mean, I don't, well, the
If he
problem is
chooses
he
to.
hasn't been insured, and that worries me, because as I say to him, if you break your leg and it's $50,000,
Yeah.
I'm gonna have to try and help you, so let's get some health insurance, you know? And for God's sake, go back to work, you know, I mean, he's 56 years old, so he's got some.
When you're
time.
incurring that kind of medical debt,
Yeah.
it's gonna be very, very, very overwhelming for individuals who are uninsured, who incur that medical debt. It just weighs on you because in some cases, it's catastrophic, the amount of money.
Right.
I saw the bill for this when
Yeah.
I had my knee surgery, and I was blown away how
Yeah.
much it cost. So just to have to incur that kind of debt, it's not just the debt itself, it's all of the peace of mind that you don't have and the things that are just weighing on you that just go on and on and on. He's the perfect candidate, though, for the Pennie platform. He really is. I'm gonna make sure that you have a piece of paper to bring with you tonight that you can hand to him. He's more than welcome to call me directly, but his best bet is to call our contact center. I can't enroll anyone, all I can do is just share information. So his best bet would be to make sure that he gets to an assister or a broker or somebody, or our contact center,
Right.
to help him move forward with it. Some people just don't realize that this is here. I'm so glad you guys joined us tonight. Then one or two people is more than enough to be able to share information with, because you're gonna tell your friends and you're gonna tell your friends, and it just goes on and on and on. It makes it a little bit easier. And I'm always happy to go back here to the library. We can do a healthcare insurance workshop, or maybe just one-on-one question times where we can bring an enrollment assister that can come in. Humberto is our local enrollment assister, young man that is fabulous. And he can help anybody fill out that application like that. He's got it down pat. But don't hesitate to ask. Mark has resources here at the library that you can take advantage of, that show you how to enroll, that have all the phone numbers on them. You can pick them up here at the library. I'll make sure that that Rev 1882 form is here at the library, because I know a lot of people come in here for tax resources. I'll make sure that that's here. But it really is, it's an amazing thing that President Obama did, is this is the living embodiment of what he talked about. You know, healthcare for all, and here we are. I get to work in it, I get to deliver the information to people. It's a good thing, and I know it will continue. Fiscally, it may change a little bit, but I know it will continue. We're not going anywhere. I'm not planning on it.
Any final questions from anyone? Well, Jeanne, thank you so much.
Yeah, thank you.
Yeah,
Appreciate it.
Thank you.
What a nice crowd.
All right. Thanks for coming, everybody.